Hello guys, this is Dr. Thompson, the instructor of the T-Square OET Academy. Today I'll be walking you through how you can identify the purpose of a letter. When a case note is given to you in the exam, it's very important you identify the purpose of the letter clearly. If you fail to identify the purpose of the letter, it will impact negatively on your writing. So I'm going to walk you through on how you can do that. If you are just joining my channel for the first time, I would advise you hit the subscribe button below so that anytime I release any video, you will be the first to be notified. All right, so let's get started. Now, what do we mean by the purpose of a letter? The purpose of a letter is the summary of what the reader needs to do for the patient. So there is a reason why you are writing this letter. There's a reason why you are referring this letter, referring this patient, transferring this patient, or discharging this patient. There's something you want the reader to do for this patient. The summary of those things you want the reader to do for the patient is what regards at the purpose of the letter. Now, how do you identify the purpose of the letter when a case note is given to you? Usually when a case note is given to you, you have a lot of information in there, but identifying the purpose of the letter is actually quite easy. First, the first place to go is to go to the writing task. When a case note is given to you, first move to the writing task. Usually the purpose of the letter is clearly stated in the writing task. For example, look at this case note. Using the information in the case note, write a letter of referral to Dr. Clinton, an endocrinologist at Lakeside Hospital for further management of Mrs. Robinson's sugar level. Address the letter to Dr. Aya Clinton, endocrinologist, Lakeside Hospital, Newton. Now, this is the writing task given to you. How do you now find the purpose of the letter here? Now, if you read here, this information says for further management of Mrs. Robinson's sugar level. So this means why you are writing this letter is for further management of Miss Robinson's sugar level. That's the reason why you are writing this letter. And this is how you are going to state it in your letter writing. Usually we quote the purpose of the letter in the introduction. You state it clearly. You don't need to paraphrase this information because that's a mistake that some students make. They change this management maybe to something like evaluation assessment. It's be given to you clearly, state it, quote it the way you are given. I can write something like this. I'm requesting your management. I'm requesting for you to manage Mrs. Robinson's sugar level. Okay. Now let's also look at this writing task again. Remember, when a case note is given to you, the first place to move to is the writing task to check for the purpose of the letter. Okay, here this information says, using the information in the case note, write a letter of referral to Dr. Peterson, a consultant cardiologist. In your letter, summarize Mrs. Benita's history and treatment so far, requesting advice and a review of her current medications. In this case note here, Mrs. Benita's history and treatment is not the purpose of the letter, rather requesting advice and a review of her current medications. That is the purpose of the letter here. So in your introduction, you are going to state it clearly that you are requesting advice and a review of Mrs. Benita's current medications. You don't need to paraphrase this, okay? All right, sometimes you might not see the purpose of the letter. In the writing task, the next place to look out for is the plan, okay? For example, this is the ending part of this case note. So reading this case note here, if you read this writing task, the purpose of this letter is not stated here because here says, use the information given in the case note, write a letter of discharge to to Miss Anderson, the head nurse of a Nightingale Nursing Home. In your letter, briefly outline Mrs. Thompson's history as well as your concerns and recommendation. Now, you are telling you what to do. This is not what you want the reader to do. So, briefly outlining Ms. Thompson's history as well as your concerns and recommendation are not the purpose of the letter. Okay, so we go to the plan. Look at this plan. Write to head nurse at nursing home for temporary care. So why you are writing this head nurse is for temporary care. So for temporary care is the purpose of this letter in this regards. All right. Sometimes the purpose of the letter will not be clearly stated in the writing task, and you cannot find it in the plan. So when it is not clearly stated, for example, in this case, read the writing task. Using the information given in the case note, write a letter of referral to the mental health physician, Dr. Chuan at this address. Here, nothing is said here of what the mental health physician need to do. If you also go to the plan, refer to mental health physician. Here again, nothing is clearly stated. So in this case, you're going to use your discretion. Definitely this person has anorexia nervosa. Most likely you might want this mental health physician to evaluate and manage this patient or to assess and treat this patient. In this regard, you use your discretion. All right, sometimes the purpose of the letter, you should know that the purpose of this letter is not complete without identifying the problem in the case notes. Okay, there is always a reason for anything. You have to find it. Now, let's go back a little bit. Now, if we go back to the first task, this first task says for further management of Mrs. Robinson's sugar level. This is the purpose of the letter. This is what you want the reader to do. Why would this reader do this? You have to state the problem. Most likely, this patient's blood sugar level is not well controlled. So you have to state it in your letter, in the introduction, because in your introduction, you have to state the problem clearly and the purpose of the letter clearly. If you find it difficult, if you are finding it difficult on how to write in the introduction, you can go to my YouTube channel and see the my tutorial on how to write introduction in OET letter writing. Here again, we are requesting advice and a review of our current medication. Most likely, there is a problem with the medication. So you have to identify the problem on ground why you are requesting this. Okay. So that is it. So it's very important you know how to identify the purpose of your letter writing. This is where we come to the end of this short tutorial. Bye-bye.